That's right. All right, let me talk about what I'm here about to tell you about, and that is pain. And one of the things I want to start off first by saying is basically the type of pain I'm going to talk about is what is called chronic pain. Now, there is a big difference. First off, think. If you have a problem, a health problem, it may be called arthritis. It may be called a degenerative disc. It has a name.
What is it?
You can look at the name and you know what the problem is. There's another diagnosis. This diagnosis is the number one leading expense in our healthcare system today. The name of that diagnosis is chronic pain. Now, is chronic pain a diagnosis? No, it is not. Chronic pain is a symptom. It is the only diagnosis that is a symptom. The way a person gets diagnosed with chronic pain is basically they've tried everything they can for acute pain, and it didn't work. So after a while, the doctor sort of throws their hands up, as do the physical therapists, as do a lot of people in the healthcare field, and they will say something really crazy, like, it's all in your head. Folks, all pain is in your head. You cannot have pain. It is physically impossible to have pain unless it's in your head, because that's where you sense pain. Now, one of the things that you will hear, the insurance industry is very good on this, is you will hear people say in the insurance industry especially, well, if you have pain, 95% of the time, all you have to do is lay back and rest, take some aspirins, take some anti-inflammatories, and everything will get better. Well, that's a good way to treat pain. But the problem is the people that develop the diagnosis called chronic pain, they did all of those things, and they didn't work. And that includes taking what we call sugar pills or placebo. There's a group of people, yeah, you can do anything to them, and 15% of them will get better. Well, what happens with the chronic pain patient is they have already tried everything. Sometimes it includes surgeries. And there are a lot of complicating issues following surgery. One of the biggest complicators is scar tissue. So what happens is the insurance industry many times wants to say with the chronic pain patient, if you do anything to them and they get better, you're here, oh, well, it's just placebo. No, it is not. The only way the patient got the diagnosis of chronic pain was because everything else didn't work. So you're not starting off with a person that has been injured, and then all of a sudden, they treat them, and they get better. And for some of those patients, they used a placebo, and they got better. But the people that are chronic pain, even placebos didn't work. That's why they are where they are.